If you have ever experienced ringing in just one ear, not both, just one side, this video is important for you. Because while ringing in both ears is often harmless and common, ringing in only one ear can sometimes be your body's way of signaling something happening deeper inside your head, something that deserves real attention. In this video, we are going to break down what one-sided ringing in the ear can mean, when it is likely harmless, and when it could be a sign of something more serious going on inside your brain or nervous system. Let's get into it. First, let's understand what this ringing actually is. The medical term for it is tinnitus. Tinnitus is the perception of sound, usually a ringing, buzzing, hissing, or whooshing noise, when there is no actual external sound present. It is incredibly common. Millions of people experience some form of tinnitus in their lifetime. Most of the time, tinnitus affects both ears, and it is usually connected to things like age-related hearing loss, exposure to loud noise over the years, or earwax buildup. In these cases, it is generally not a sign of anything dangerous. But one-sided tinnitus, ringing that only happens in one ear and not the other, is different. And it is different in a way that doctors take much more seriously. Here is why. When tinnitus only affects one side, it often means the cause is something localized, something specific happening in that one ear, that one auditory nerve, or in the part of the brain connected to that side. This narrows things down significantly, and some of the possible causes are conditions that genuinely need medical evaluation. One of the conditions doctors look for when someone reports one-sided ringing is something called an acoustic neuroma. This is a non-cancerous tumor that grows on the nerve connecting the inner ear to the brain, specifically the vestibulocochlear nerve, which controls both hearing and balance. Acoustic neuromas grow slowly, often over years, and because they grow gradually, the symptoms can be easy to dismiss at first. One-sided ringing is often one of the very first signs. As the tumor grows, it can also cause gradual hearing loss in that one ear, a feeling of fullness or pressure, and sometimes balance problems or dizziness. The reason this matters so much is that early detection makes a real difference. Acoustic neuromas are typically not cancerous and do not spread to other parts of the body. But if left undiagnosed and allowed to grow for a long time, they can press on important structures in the brain and cause more serious complications, including effects on facial nerves and, in rare cases, more significant neurological issues. This is exactly why doctors take one-sided tinnitus seriously, even when it seems mild. It is not about causing alarm. It is about catching something early, while it is still small and highly treatable. Another possible cause behind one-sided ringing involves blood vessels. Sometimes the ringing people describe is not a typical tinnitus sound, but more of a rhythmic whooshing that matches their heartbeat. This is called pulsatile tinnitus, and when it occurs on just one side, it can be related to changes in blood flow near the ear, sometimes connected to blood vessel abnormalities, increased pressure, or, in some cases, narrowing or irregularities in the blood vessels near the brain. This type of one-sided, rhythmic ringing is something that should always be evaluated by a doctor because it points to a vascular cause rather than a typical hearing-related one. So how do you know the difference between ringing that is likely harmless and ringing that needs medical attention? A few signs make one-sided tinnitus more concerning. If the ringing is persistent and does not go away after a few days. If it is accompanied by hearing loss in that same ear. If you notice any dizziness, loss of balance, or a feeling of fullness in the ear. Or if the ringing has a rhythmic, whooshing quality that seems to match your heartbeat. Any of these signs are reasons to schedule an appointment with a doctor, ideally one specializing in ear, nose, and throat conditions, or a neurologist. Let's continue talking about what one-sided ear ringing can mean for your health. Another condition connected to one-sided tinnitus is Meniere's disease. This is a disorder of the inner ear that affects balance and hearing. It typically affects only one ear, which is exactly why the ringing tends to show up on just one side. Meniere's disease happens when there is a buildup of fluid in the inner ear, and it causes a cluster of symptoms that tend to appear together. Ringing in one ear, a feeling of fullness or pressure in that ear, episodes of vertigo where the room feels like it is spinning, and gradual hearing loss that comes and goes, especially in the early stages. What makes Meniere's disease tricky is that the symptoms can come in episodes. Someone might experience ringing and dizziness for a few hours or a few days, and then feel completely normal for weeks or even months before it happens again. Because of this pattern, many people delay seeking medical help, assuming each episode was a one-time thing. But Meniere's disease tends to progress over time if it is not properly managed. Repeated episodes can lead to permanent hearing loss in the affected ear. This is why doctors recommend getting evaluated after the very first episode of one-sided ringing combined with dizziness or balance issues, rather than waiting to see if it happens again. Now let's talk about something more directly connected to brain health. One-sided tinnitus, especially when it comes on suddenly and is paired with other neurological symptoms, can sometimes be linked to issues affecting the brain itself rather than just the ear. This includes conditions affecting blood flow to the brain. When blood flow to a part of the brain is reduced or disrupted, it can sometimes produce unusual sensory symptoms, including ringing in one ear. This is rare, but it is exactly why doctors pay close attention when one-sided tinnitus appears suddenly and is accompanied by other symptoms like sudden severe headache, numbness or weakness on one side of the body, confusion, difficulty speaking, or sudden vision changes. If one-sided ear ringing ever appears alongside any of these symptoms, this is considered a medical emergency, and you should seek immediate medical attention. This combination of symptoms should never be brushed off or monitored at home. Another factor worth understanding is the connection between one-sided tinnitus and high blood pressure. When blood pressure is significantly elevated, it can affect blood flow patterns near the inner ear and sometimes contribute to a whooshing or pulsing type of ringing, often on one side. This is one of the reasons doctors will often check blood pressure as part of the evaluation when someone reports new-onset one-sided tinnitus. So, what actually happens when you go to the doctor for this? The first step is usually a thorough hearing test called an audiogram. This measures whether there is any hearing loss in the affected ear and helps doctors understand the pattern of the issue. If hearing loss is present specifically in the ear with the ringing, this raises the importance of further investigation. The next step, especially if an acoustic neuroma or another structural cause is suspected, is typically an MRI scan of the brain and inner ear area. This type of imaging allows doctors to see soft tissue structures clearly, including the nerves connecting the ear to the brain, and can detect tumors like acoustic neuromas even when they are still very small. If a vascular cause is suspected, especially with pulsatile tinnitus, doctors may also order imaging that specifically looks at blood vessels, such as an MRA, which stands for magnetic resonance angiography, or in some cases, a CT angiogram. These tests allow doctors to examine blood vessels near the ear and brain for any abnormalities. Blood pressure will almost always be checked as part of this evaluation, along with basic blood tests to rule out other contributing factors like anemia or thyroid issues, both of which can sometimes contribute to tinnitus symptoms as well. The important thing to understand is that this evaluation process is not meant to scare you. Most people who go through testing for one-sided tinnitus do not end up with a serious diagnosis. Many cases turn out to be related to earwax buildup, minor nerve irritation, or other manageable causes. But the only way to know for certain is through proper evaluation. And catching something early, if there is something to catch, makes an enormous difference in how it is treated and how well it responds to treatment. Let's talk about what you should actually do if you are experiencing ringing in one ear right now. The first step is simply paying attention. Notice when the ringing started. Notice if it is constant or comes and goes. Notice if it is in one ear only or sometimes shifts. Notice if you have any other symptoms alongside it, like hearing changes, dizziness, headaches, or a feeling of fullness in the ear. This information is incredibly valuable to a doctor and can help guide the evaluation much more efficiently. If the ringing has been present for more than a few days, do not wait it out hoping it will resolve on its own. Schedule an appointment with your doctor. You can start with your primary care physician, who can refer you to an ear, nose, and throat specialist or a neurologist if needed based on your symptoms. If the ringing came on suddenly and is accompanied by hearing loss in that same ear, this is considered more urgent. Sudden hearing loss combined with one-sided tinnitus is something that should be evaluated within days, not weeks, because some causes of sudden hearing loss respond much better to treatment when caught early. And as we mentioned earlier, if one-sided ringing ever shows up together with sudden severe headache, numbness, weakness, confusion, or difficulty speaking, this requires emergency medical attention immediately. Do not wait. Do not monitor it at home. Go to the emergency room. Now let's talk about what you can do in the meantime while waiting for your appointment, or simply to support your overall ear and brain health. Protecting your ears from loud noise is important, even if the ringing is only in one ear. Continued exposure to loud sounds can make any underlying issue worse and contribute to additional hearing damage over time. If you are regularly around loud noise, wearing proper ear protection makes a real difference. Managing your blood pressure is also important, especially if your doctor identifies any vascular component to your symptoms. Keeping blood pressure within a healthy range supports proper blood flow throughout the body, including the small vessels near the ear and brain. Reducing caffeine and alcohol intake can sometimes help as well, since both can affect blood flow and may intensify the perception of tinnitus for some people. This is not true for everyone, but it is worth paying attention to whether your symptoms change based on your intake of these substances. Managing stress is another factor that genuinely matters. Stress does not cause tinnitus, but it can make the perception of it feel more intense and more noticeable. Many people report that their ringing feels louder during periods of high stress and less noticeable during calmer periods. This does not mean the ringing is not real. It simply means your nervous system is more attuned to it during stressful times. Getting adequate sleep also plays a role, both in how tinnitus is perceived and in overall nervous system and brain health. Poor sleep can heighten sensitivity to internal sounds like tinnitus and can also affect blood pressure and overall recovery. Now let's bring this all together. Ringing in one ear is something that deserves attention, not panic. Most cases turn out to have manageable causes. But because one-sided ringing can sometimes point to something more specific happening in the ear, the nerve connecting the ear to the brain, or the blood vessels nearby, it is not something to ignore or assume will simply go away. The key signs to watch for are ringing that persists for more than a few days, ringing paired with hearing loss in that same ear, ringing accompanied by dizziness or balance problems, a rhythmic whooshing quality that matches your heartbeat, and especially any sudden neurological symptoms appearing alongside the ringing. If you recognize any of these patterns in yourself or someone you know, the right step is simple. See a doctor. Get evaluated. Early detection when something does need to be caught changes outcomes significantly. This video is meant to inform you, not to alarm you. Most people experience tinnitus at some point in their life, and the vast majority of cases are not connected to anything dangerous. But understanding the difference between common, harmless ringing and ringing that warrants medical evaluation is information that genuinely matters, and information that could make a real difference for you or someone you care about. If this video helped you understand something new, Share it with someone who might need to hear it. And if you are currently experiencing any of the warning signs we discussed today, do not wait. Make that appointment. Take care of your health and take care of your ears. They are connected to more than most people realize.